This is a video of a presentation. The title is the study is the title is up at the top. It's a study of Vivitrol before or after release from the Philadelphia County Jail with opioid addictive prisoners. It's a PCORI study done under a 3-year contract. The primary objective is right there, as you see it. Does providing extended release injectable naltrexone before release result in less relapse during the first 3 months after release than if it's offered by referral to a local treatment provider. This is a description of the study. We were shooting for to randomize 200 patients, stratified by male, female, half randomized to get the shot in prison, in jail rather, before release, the other half to report to a local treatment program to receive it after release. They were to get urine tests and counseling weekly, more extensive evaluations monthly, and the most extensive at 3 and 6 months. The settings were the Philadelphia Department of Prisons, the county jail. You see it there on the screen. There's 6 buildings located in 30 acres in Northeast Philadelphia. Has 6,000 to 8,000 inmates, 6th largest correctional facility in the U.S. Starting agonist treatment was not allowed at the time the study began, but toward the end of the study, they started a buprenorphine program. The outpatient follow-up was at Net Steps, which is an opioid treatment program. It's about a 15-minute walk from the prison, county jail. And it also has an ongoing relationship with the jail where it provides methadone to prisoners who are on it when they're incarcerated. All the others are detoxed. This is an aerial view of the prison. You see the 6 buildings scattered across those 30 acres. And the inmates are mostly nonviolent. They rarely stay longer than a year. A lot of incarcerations, average age 34, reading level 5th grade. Average number of aliases a little over 2.5, about 30% female, about 30% homeless. Big problem was only 10% know their release date. Others get released when they're sentenced at a hearing. They have to go downtown for a hearing with a judge, or they make bail. And this was an issue because the research assistants had to estimate the release dates based on what the prisoner said, and when their hearing, the prisoner's hearing was scheduled in order to time the injections before release, and that didn't always work out. Some got injected and they weren't released, and some we thought and some were released before we could give them an injection, which you'll see in a later slide. Net Steps is just a 15-minute walk from the prison, has about 200 methadone patients, few on bup. They had not used naltrexone or extended release naltrexone prior to this study, but the medical director had used it. And the treatment is a group and individual counseling, and the nurses from the program go up to the prison every day to provide methadone to the prisoners who are receiving it in prison since they were on it when they were incarcerated. A lot of recruitment steps, and you see them right there. We met with the prison staff. We had a video that we played, had flyers distributed. The most effective was to go to what they call the block ret meetings, which they have once a month, a meeting with prisoner representatives from each of the housing units, along with prison staff. They go over problems they're having, like engineering, canteen service, etc. And we were on the agenda for those meetings. We explained the study, and we always got a referral for the study after that meeting. Inclusion criteria, just opioid dependent with physiological features, no serious medical or psychiatric problems. Philadelphia addressed, eligible for Medicaid, because Next Steps required Medicaid. They basically don't take private health insurance. And almost all the prisoners were eligible, either on or eligible for Medicaid. Provide a phone and contact information on 3 or more people who know where they might be after release. They had to answer 9 to 10 questions on a quiz. And then, of course, if they came to the point where they were get the extended release naltrexone, we'd have they had to have a negative a urine test that was negative for opioids and buprenorphine, and a negative naloxone challenge. And exclusion, where if they were planning to move from Philadelphia area in the next 6 months, if their ALT or AST was more than 3 times the top limit of normal, had serious medical, psychiatric problems, chronic pain, or if they were mandated to treatment. The study had to be purely voluntary. Results were 402 submitted sick call slips over a period of about 1 year and 8 months. 180 of those were excluded for various reasons. 222 consented, and of those who were consented, 76 were excluded for medical, psychiatric, or their mandated treatment, various reasons. 146 were randomized. And of those 146 were randomized, and this was a big problem, that we lost 60 to the actual treatment because they were either changed their mind, they were transferred to another prison while they were waiting to be released. They were released before we had time to give them a shot. They were administratively withdrawn for a variety of reasons. So we lost a good chunk of them. And so we ended up with 86 prisoners who were eligible for the treatment study. And there you see how it went. When it came to the 4th month, they had follow-up naltrexone monthly for 3 months, and 9 in the group that received it before release had continued. 9 of the 38 had continued up through month 4, and in those who to get it after release, 10 had continued it. So there was a significant dropout, but around 22%, 23% continued it for 4 months. Assessing the primary outcome was difficult because it was once they were released, it was hard to get a hold of them, a lot of missed appointments. We developed a phone-based questionnaire about opioid use, treatment, and withdrawal. And using that plus data obtained on patients who kept appointments, we could confirm relapse or non-relapse in almost 3/4 of the patients. And the primary outcome focused on those 96. And this is interesting. If they were to get it before release, they all got the shot. And then about half of them got the first follow-up shot, and then it went down to about almost 24% got the 4th shot. If they were to be go to the local treatment program, which was just a short walk from the jail, as you see, only about 1/3 got the first shot, and it went down. But interestingly, by the time you get out to the 4th injection, it was approximately equal number of patients in each group. And there you see all the missing data. A little over 1 monthly urine drug screen on average had less than half with timeline follow-back. So we had a really serious problem with the missing data, even though we had staff that would go out and could see them in the community or at home. Our relapse here at 3 months, it was not significant difference. There were there are the statistics. No significant difference in relapse between the groups. 0.20 was the p-value. The odds released for relapse versus non-relapse. There you see it. And there were more unknowns in the after release group. We have I presented a few secondary outcomes. So we have so much missing data. We had planned a lot more secondary outcomes, but the ones that we could count on were weeks in study treatment, and we calculated that as weeks protected by extended release naltrexone plus the weeks of one or more counseling sessions after they were no longer protected. And there you had a big difference favoring those who got the shot before they released, primarily due to the larger number of injections that the before release patients received in the first few weeks. And then another one was reincarceration, and these data were provided by the prison system. And most of the reincarcerations were from probation violations. The other was new charges. And almost 60% were reincarcerated during the 28 months of the study. And there were significantly more reincarcerations among those who were referred to get this shot before we released versus after release. Overdoses is another secondary outcome. We recorded 16 among 9 patients. 3 overdoses were before release, 6 in after release. 1 in the before release died a week after he lost protection from the shot that he got in prison. 2 other overdoses in that group recovered after missing 3 doses. There were 3 overdose deaths in the after release, and 2 of those were within 1 or 2 weeks of relapse, just what you read in the literature, that particularly high risk group, high risk period right after the release. And of the overdoses in that after release, 4 of the patients were never medicated, 2 were medicated but missed a dose, and 2 of the after release patients survived multiple overdoses. 1 had 3, the other had 4 overdoses. So overdose was a significant problem, as it is throughout the city of Philadelphia. So conclusions: the primary outcome was inconclusive, very frustrating, but true. The before release group was much more likely to receive their first dose. So, about equal numbers of people in each group continuing on naltrexone out to month 4, about a little less than a quarter. There were more reincarcerations in the before release than the after release, and there were many unpredictable events and unpredictable release dates that led to a 40% loss to study treatment after randomization. We had excellent cooperation with the prison department, could not have been able to do this study without that. And the absence of overdoses while on extended release naltrexone is certainly consistent with the pharmacological effect of the drug in that it blocks opioid effects for about a month. We found it easy to start treatment in jail, but continuing it after release was a problem. The patients expressed motivation; they really seemed genuinely interested in treatment, but that obviously wasn't the first thing on their mind due to the dropout from treatment after they were released. And this dropout pattern may not be unique to extended release naltrexone. The jail started a buprenorphine study toward the end of this study, and 52% of the first 400 prisoners that were started on buprenorphine did not fill the prescription for continuing care that we're giving them prior to release. So that's our study, and it was hard to do, very labor intensive. I'll also say very interesting. Thank you very much.